thank you for joining us today for our virtual Lunch and Learn event for Samaritan Advantage Health Plans 2023 benefits. For those of you who have joined this event in the past, you may notice that Dr. Iwanchenna is no longer our moderator. If you received and read our last member newsletter, then you know that Dr. Iwanchenna is no longer with Health Plans, but he is still in the Samaritan family. He's moved over to do more patient care through our Samaritan Medical Group. So we're very sad to see him leave us, but very happy he's still in the family, and he's going to have some very lucky patients that he's seeing. So my name is Daniele Hunter. I'm the Implementation Program Manager for Samaritan Health Plans Medicare Programs Department. I've worked for Samaritan for about 8.5 years now. So before coming to Samaritan, I worked as a pharmacy technician while getting my bachelor's degree from Oregon State University. Go Beavs. I've worked in a number of departments in Samaritan over the years, including our pharmacy services department, appeals and grievances. But for the last 3 years or so, I've supported our Medicare plans, and I joined the Medicare programs department when we formed it. So during our question and answer portion of the presentation, we'll be joined by a few representatives from some other departments within Samaritan. For customer service, we have Harvest Villemeyer. She's been with customer service for 11 years in many different roles. Her current role is to train incoming and current customer service staff, along with being a daily support to customer service. She enjoys imparting the knowledge and skills that staff need to help our members understand their health insurance and ensure that they're able to receive the care that they need. From enrollment, we have Brooke Strenke. Brooke has been with Samaritan for 13 years, and with the enrollment department for 10 of those years. And she's been the supervisor of our enrollment department for the last 7 years. From pharmacy services, we have Marika Davies. She is our pharmacy benefits coordinator, and her role focuses on Medicare Part D specifically. Marika graduated with her Bachelor of Science from Western Oregon University with a degree in Community and Public Health, and she has been at Samaritan for 4 years. And we really appreciate these departments and representatives joining us today. So I'm going to go over some rules of the road for our meeting today. Please use our meeting chat feature to type any questions or comments that you have. For those calling in today, we'll do our best to unmute you at the end of the presentation so that you can ask your questions. We will hold all questions until the end. We want to make sure that we address everyone's questions and allow for enough time to get to those. You have a chat button located on the top menu of your screen. There's like a little chat bubble, and so you can click on that and then type a message in there. If you don't see that, you may have a 3-dot menu on your screen. Here, if you click that, it will give you additional options.
Oh.
During the question and answer portion of our seminar, you may raise your hand and we will unmute you when your name is called. You may also need to click on your microphone to unmute yourself so that we can hear you. Because some of the questions that are asked can be complex, there may be questions that we can't fully answer today. So any questions that aren't answered, along with those that are, will be mailed out to you along with the $15 gift card. And most importantly, please bear with us through any technical issues that arise. You can expect a survey to be mailed to you within 2 weeks, and you'll also receive a recording of the presentation. We appreciate your feedback regarding today's presentation as well, and thank you in advance for sending that to us. And with that, I will go ahead and get started with our content today. So, Samaritan Advantage Health Plans. What is new for 2023? We value the feedback that we get from our members, and we do take that into consideration when we're designing our benefits for the new plan year. Obviously, we wish that we could give everyone everything that they wanted and only make positive changes, but unfortunately, that just is not a possibility. But we are very excited to announce that we have the same premiums, same benefits, and the same great local service. Well, our premiums, except for our special needs plan, will not be changing for 2023. I did just want to take a moment to remind everyone what the premiums are for each of our plans. So for our Premier Plan Plus, that premium is $129 per month. Our Premier Plan is $19 per month. Our conventional plan, which is a medical plan only, it does not offer Part D prescription drug coverage, has a $50 per month premium. And then our special needs plan, which is a plan for members who are duly eligible for both Medicare and Medicaid services. That premium did increase just slightly from $40.50 a month to $41 a month. We follow the premium that's determined by CMS for that plan, and so that's why that tends to change every year. But our members on that plan do receive extra help, and they don't actually pay that premium amount out of pocket. So we'll start getting into changes here. You should have already received your annual notice of change document in the mail. And back at the end of September. If for any reason you didn't receive that, please put a note in the chat or contact customer service, and we can get a new one mailed out to you. The changes to our out-of-pocket maximum amount is probably one of the most notable for 2023. We never like to have to raise costs, but unfortunately we were in a position where we were going to have to increase this amount or increase the premiums, and we felt that increasing our out-of-pocket max amount would have a lower impact to members than raising your monthly premium amounts. So for our Premier Plan Plus, that amount has increased from $4,600 per year to $4,800 per year. Premier Plan from $4,600 to $5,000. Conventional from $4,600 to $5,200, and the special needs plan, that increase looks very dramatic, but from $3,750 to $8,300 for the year. And again, members who are in that plan generally don't pay any money towards that amount because it's picked up by the Medicaid coverage on the other side. So as a reminder, the out-of-pocket maximum is the amount that you pay, the maximum amount that you pay for covered in-network Part A and Part B services. So that means it's only the services that are covered on original Medicare, which we typically refer to as Part A and Part B. So that's your things like your doctor's office visits, inpatient care, surgeries, all those kind of standard benefits that are covered under a health plan. The supplemental or extra benefits that we provide to you as a member of our plan do not apply to that out-of-pocket maximum amount. So, for example, your routine chiropractic and acupuncture services, routine eye and hearing exams, your dental and hearing aids, those kind of extra things that we give you, that won't apply to this total amount. And if you do reach the out-of-pocket maximum amount, you do still have to pay any copays that apply to those services.
Right there.
Outpatient hospital services. So this is surgery or services that are provided in the outpatient hospital setting or an outpatient hospital treatment room. This is another noticeable change that we made in 2023, particularly for our members who are on our Premier Plan Plus. So that actually changed from a 15% coinsurance, to a $300 copay. So This is a change that we've been working toward for quite a while. That was our only plan that still had a co-insurance on it instead of a copay, which is really not the most ideal benefit for you as a member because it means that amount that you pay isn't predictable in the way that having a copay is, right? So it's you get charged 15% of whatever the allowed amount of a service is, and there's not a lot of good ways to know what that is up front. So this really makes it a more predictable cost for members. So as I mentioned, Premier Plan Plus will be a $300 copay. Premier Plan is changing from a $250 copay to a $350 copay. Conventional is changing from a $200 copay to a $325 copay. And then our special needs plan stayed the same at 20% co-insurance. And again, the reasoning for the cost shares kind of on that plan is that Medicaid will pick up whatever the Medicare side of the coverage didn't pay for. Ambulatory surgery center services, similar to the outpatient, those are we have a slight increase to those for 2023, specifically for our Premier Plan and conventional plan members. So Premier Plan Plus is staying the same at $250 copay. Premier Plan is changing from $250 to a $275 copay. And conventional from a $250 copay to a $300 copay. And the special needs plan, again, staying the same at 20%. So now we'll get into our more positive changes that we're making for 2023, the first of which being routine vision hardware. So this is eyeglasses or contact lenses that you need just if you have near or farsightedness. It's not for glasses after cataract surgery. That is a separate benefit. And this includes any upgrades such as the progressive lenses, tinting, scratch resistance, or the anti-reflective coatings. And this is one of those benefits that you use your Benefits MasterCard to pay for. For our Premier and Premier Plus and Premier Plan members, you are getting a $100 per year increase to this benefit. So in 2023, you will have $225 to spend for the year for this benefit instead of $125. Conventional is staying the same at $125 for the year, and the special needs plan is staying the same at $175 for the year. Our non-emergent transportation benefit. So this was a new benefit that we added in 2022. We partner with Cascades West Ride Line to give transportation to our members to and from any health-related location. So in 2022, we were only allowing 12 one-way trips per year on Premier Plus, Premier, and Conventional. In 2023, you will have unlimited trips available. So we're very excited to be able to offer this option for our members to make sure that you can get where you need to go, whether it's for a provider visit or surgery, or maybe you just want to go to the gym or some sort of event at a senior center, you can use this benefit to get you there. The special needs plan is staying the same at 24 one-way trips per year, but the reasoning for that is, again, because under the Medicaid coverage, you have unlimited trips, so you can use that to get to these Medicare visits as well. And then there's a few miscellaneous changes that we made to plans. So on Premier Plan Plus and Premier, the Medicare covered dental benefit, we're lowering the copay on that from $25 to $20. And on our Premier Plan Plus, the Medicare covered hearing exam is lowering from $30 to $25 copay. On our special needs plan, the most that you'll pay for an urgent care visit is lowering from $65 to $60. And the over-the-counter benefit, which is also a new one that, well, I guess it wasn't new for SNP. We did have that for SNP, but that benefit is increasing from $150 a quarter to $195 a quarter. And a reminder for a couple of these benefits, the Medicare covered hearing exam is a diagnostic hearing imbalance evaluation to determine if you need medical treatment. So it's separate from just a routine hearing benefit which is more to determine if you need hearing aids or something like that. And the Medicare covered dental exam, again, is another really specific benefit that's really if you need to see a dentist or oral surgeon for surgery of your jaw or related structures, setting fractures of the jaw or facial bones, and extraction of teeth to prepare for radiation treatment or neoplastic disease. So that is what that benefit covers. And then another change that you may notice is that we are no longer requiring that you have an assigned PCP or primary care provider on file with us. So that doesn't mean that you shouldn't have a PCP, but it just means that you're not required to tell us who that PCP is. So in the past, it's usually when, like, the first time that you enroll with us, it's a question on your enrollment form, and if you didn't have a PCP, we would have to assign one for you. So that will no longer be a requirement. We are still more than happy to help you find a PCP if you need, but we won't be required to just pick one for you, before you have a chance to see them and decide if you like them. And then if you change PCPs, you're not required to tell us that you changed. So it gives you a little bit more freedom in choosing your PCP or making a change if you need to. And then I just wanted to give a chance to see the types of providers that we do consider as a PCP for our plans. So those are an internal medicine physician, a family practice physician, general practice physician, geriatric physician, a family nurse practitioner, a physician assistant, or even a pediatric physician can be considered a primary care provider for you. Changes that we made to services that require prior authorization. So the first one is that diabetic therapeutic shoes and inserts no longer require prior authorization. For magnetic resonance imaging or MRIs and magnetic resonance angiography or MRAs, we only require prior authorization if they're doing imaging of the breast, cervical, or lumbar or thoracic regions. So really the breast or any area of the spine. Those will be the only ones that require prior authorization. And then all skilled nursing facility stays will require prior authorization. So previously we had changed that to only being stays that were going to be longer than 7 days. Going forward, it will be all skilled nursing facility stays. And our pharmacy changes for 2023. So really the majority of these are changes that are dictated from a higher level. So either the Centers for Medicare or Medicaid Services, or even at a federal legislature change. And we'll talk about that here in just a little bit. The change that we did make internally is for the Premier plan, which has a Part D deductible amount. That's been reduced from $200 to $175. And as a reminder, that deductible does only apply to drugs that are on tiers 3, 4, or 5 of our formulary. For our Premier Plus, and Special Needs plan, the initial coverage amount has increased from $4,430 to $4,660. So these are the changes that come from CMS that I just mentioned. So we don't set these dollar amounts. They're set by CMS and we follow them. This initial coverage amount is the amount of what you and the plan spend. When it equals this $4,660, that's when you enter into the coverage gap or the donut hole. The other number that has increased is the out-of-pocket threshold, from $7,050 to $7,400. So this is the amount that gets you out of that donut hole and into the catastrophic coverage phase. And that amount is what you pay for the entire year. So that takes into account that first $4,660 that was spent to get into the threshold, or however much of that was out of your pocket. And then once that your total spend for the year is $7,400, you will enter the catastrophic coverage phase. I mentioned some changes that have come down from a federal legislation level, and that's these last two bullets here, which is insulin will not cost more than $35 for a 1-month supply, regardless of what tier it's on or what stage of coverage that you're in. So even if you're in the donut hole, or in the initial part, it will never cost you more than $35 for a 1-month supply. And the other change is that most Part D vaccines will be covered at no cost. And this is, again, regardless of what tier we have it listed on and what stage of coverage that you're in. So those are pretty exciting changes at that federal level for you guys as members. And then lastly, for our Premier and Premier Plus plans, what you pay when you enter that catastrophic coverage stage is changing from either 5% coinsurance or $4.15 for a generic drug, or $10.35 for all other drugs, whichever is a larger amount. So that's a little bit of an increase from what it was in 2022, which is $3.95 or $9.85. And that's, again, a change that comes from CMS that we follow. So I'll say that again because it's a little bit confusing. I feel like how it came out of my mouth. So you pay either 5% or $4.15 for a generic drug, or $10.35 for any other drug, but it's whichever is the larger of those amounts. And so this is a change that actually occurred on October 1st, but I wanted to go ahead and mention it here for everybody. If you don't already know, we do have a new online OTC store available. So it allows you to order from a catalog of covered over-the-counter items. You can either do that online on the website, which is SamaritanOTC.com, or you can order by phone or by mail. So it includes a lot of covered items that maybe you weren't able to purchase successfully using your card in a store or retail setting. And the most obvious example of that is dual purpose items such as vitamins and minerals, which if you've used the benefit card in the store, you know that those unfortunately don't pay at the register with that. So, but now you can go on this online store and choose any of these items that are on there, and you know that your benefit card will work to pay for them. So it makes it a little bit of a better experience if you want to be sure that your card is going to work for the items that you're picking out. And there's also additional items like support items, bath or shower rails, and toothbrushes and toothpaste, which fun fact, as we've been monitoring the sales through that site, toothbrushes and toothpaste are one of the most bought items so far. If you want a printed copy of that catalog or you have any questions, please reach out to our customer service team. They are fantastic and they will help you through that. And it is the annual election period. So I just wanted to remind everybody here, the annual election period occurs every year from October 15th to December 7th. So we're about halfway through that time. And this is when CMS allows any member who is Medicare eligible to make a plan change. So it's restricted through the rest of the year. So there are some special times when you can make a change or under special circumstances, but this is the main time of the year that you are able to change your Medicare plan. If you want to remain on your current plan, you don't need to do anything. You'll be automatically enrolled. If you want to change to a different Samaritan Advantage Health Plan, you will need to submit a plan change form. If you call this number on the screen, or if you'd like to talk to somebody about changing plans, they can help walk you through that process. If you want to change to a different health plan, you do need to submit an application directly to that plan. You are able to submit more than one application during the AEP timeframe, and the last application that's received before that December 7th deadline is the plan that you will end up being enrolled in. And I also wanted to just make this special announcement to all the members that we had joining us here today. With the launch of that online OTC store that we just talked about, we did find that there was an issue with some of the cards that were printed at the very beginning of 2022. Some members are missing the 3-digit CVV code that is on the back of any credit or debit card at the end of the signature line. You do need to have that 3-digit CVV code to be able to make purchases from online merchants. So please check the back of your card to see if you have that CVV code. If you do not, you will need to get a replacement card so that you can place orders online. And there's a couple different ways you can do that. One way is to log into the benefits card portal. You do that by going to myhealthplan.samhealth.org. And on the right side of the screen, there's a button that says Benefits MasterCard. If you just click that, it will automatically sign you in to your benefits card portal. From there, there is a My Account drop button from the drop down on the left side of the screen. You select Manage My Debit Card, and then select your current card. If you've ever had one reordered, it'll show you the previous card and then your current card that's in use. And then there's a button that says Report Lost or Stolen. And you just select that and then click Yes, and it will automatically order a new card to your address. The other way is you can contact our customer service team and they can assist you in getting a new card ordered for you as well. It does take I think roughly between 5 and 10 days to get that new card mailed to your home. And with that, we'll go ahead and open it up for questions. We did receive one question prior to the meeting, so I want to go ahead and address that one first. And that question was for a member who is on our Premier Plan Plus and wanted to know if they would have a SamFit gym benefit. So you do have access to SamFit, but you do need to sign up through the Silver and Fit benefit that we offer. So that SamFit is a network facility through them. So if you sign up through that, then you can choose SamFit as the facility that you wish to go to. And that, on Premier Plan Plus, that benefit does not cost you anything out of pocket.
This is Lori Lindstrom. I do have a question in regards kind of to what the other question was. is, do we have the benefit to be able to use like the Newport Rec Center and their swimming facility and classes that they offer?
I don't know that off the top of my head, Lori. I would have to look at the provider directory for Silver and Fit to see if they're in network or not.
Oh, okay. Okay.
But
So we can get that covered in a follow-up.
Okay, thank you.
Hi, this is Jerry Lindstrom. Question: to look to see, because we have a couple other health places around here, fitness places. Do we go online to look to see if they're in the system then?
Yeah, you can go to the Silver and Fit website, which I don't have the link for off the top of my head. It may just be silverandfit.com. And when you set up an account, it should give you access to the network of covered facilities for your area.
Okay, now these covered facilities, in other words, we can go in and use them if they qualify, but we don't make any payments or co-pays or anything like that?
Right. Well, depending on the plan you're on. If you're on Premier Plus or SNP, the gym benefit doesn't have a copay. But on our Premier plan, it is $25 for the year for the facility benefit and $10 for the year for a home fitness kit if you want to select one of those as well. And you can do both.
Okay.
But you won't pay any fees to the facility themselves. You pay that $25 copay to Silver and Fit, and then they set you up.
Okay, so I take it then we look at and give them we give them our plan and everything, and they'll tell us yes or no, or if there's a payment on any of them. So we don't get it to go in and then unexpectedly they tell us that we have to pay them something.
Correct. Yeah. So they'll actually, when you sign up through Silver and Fit and pick your gym, they'll either send you or it'll generate a card that you can print that shows that you have signed up through Silver and Fit and what facility you chose.
Okay.
Okay.
And you can change that facility too as many times as you want through the year. So if you're going, if you're going to be somewhere else and they don't have a center where you're going, but there's a different one that is in network, you can switch for while you're gone and then you can switch back.
So so in other words, you can only do one at a time, or can you do a couple of them because you like to go to different ones?
You can only choose one at a time.
Okay. Thank you.
Yeah, thank you.
Hello. I have a question for the health benefits card.
Okay.
If you have made some OTC purchases and in the same quarter, you have also scheduled your dental checkup and you're picking up new eyeglasses, how does that work for that quarter?
Sure. So each benefit has a separate bucket of money that is used. So they won't cross over at all. So your max for your over-the-counter, depending on your plan, is either $100 or $150 per quarter. And none of that comes from the other benefits that are available. Yeah.
Great. Thank you.
You're welcome. Okay, I'm going to try to go down the list here of some members that have their hands raised. Linda Brown. See if I can unmute you. Oh, okay, Linda, looks like you're unmuted. You have a question?
Yeah, I put them in the chat. I find
Okay.
I just get inundated with paper, explanation of benefits. Is that a Medicare requirement for the layout and frequency, or is that a Sam Health? That's the first part of it. And then what can be done to change it? Whoever's responsible, might they do a survey of members? I mean, it comes in so much, I find it sits there, and then I look at it, and it says like radiology or imaging, and then I have to go back and figure out really what things were. And I don't get a lot of test results either, or like when the next one's due, things like that. That would be more helpful.
Okay. Yeah, that's a really great question, Linda. The majority of the mailings that you receive are likely dictated by CMS, or Centers for Medicare and Medicaid Services. So they have a lot of requirements for what we have to send to members. And unfortunately, right now, the majority of the way that we are able to send that is just through regular mail on paper. If it's coming specifically from like a doctor's office or a clinic, I believe there are some ways that you can sign up to receive that information electronically through the like My Health Plan or some of those platforms that they use. Unfortunately, from the health plan side of things, we don't currently have a way to provide materials electronically to members. So that's something that we are very seriously looking into, and we're trying to get off the ground, hopefully in the near future. So that way you can opt in or out of receiving those materials electronically instead of by mail.
Yeah, well, I would, I would really like to have a survey of what people need, because I find if they just make the current layout electronic, it doesn't really solve it doesn't solve the second part of the problem.
Which is more getting the information that you actually need or want versus I don't, that's something we can look into. Unfortunately, I don't really have a good answer for you for that part of it. I suspect that most of it is still required for us to tell you. But maybe that's something that we can look into. How do we, get the more important information that you actually want to you?
Yes. Thank you.
Thank you for that. Okay, Richard? See Richard with his hand up.
Yeah, I had two questions on the quarterly benefit. Has that changed on the Premier plan for the MasterCard?
The over-the-counter items benefit specifically? That's per quarter. Is that what you're asking?
Yeah, I just wondered if there was any change from last year.
There's not a change from last year for that benefit on Premier or Premier Plus.
Okay, and the only other question I had was on the $225 eyeglasses. Does that include the examination?
It does not. The examination is a separate benefit.
Or is there an examination benefit under the Premier plan?
There is, yeah. So you can have one routine vision exam per year. I do believe it has a copay, which I don't know off the top of my head.
Okay, thank you very much.
Yeah, you're welcome. Dorothea.
Can you hear me?
I can.
Just a comment first that you can use Silver and Fit at the Newport Rec Center.
Oh, thank you.
And then I would like to know if the shingles vaccines are covered.
I believe the answer is yes. I'm going to ask Marika if she can help me out with that one. She's the expert on that Part D side.
Okay,
Yep,
thank you.
that vaccine series is covered at a $0 cost share.
Okay, I was told at Walmart that they did not cover it, so that's why I asked.
Were you asking for the current year or for next year in 2023?
Well, at this point, it can wait till next year, but either one.
Yeah, so for next year, it is covered at a $0 cost share. It would be covered this year, but I believe that is a tier 3. I would have to double check our formulary, but there would be a cost share to it this year.
Okay, thank you.
No problem.
Thank you, Marika. I see Jerry still has his hand up. I think we heard from you, Jerry. Do you have another question, or did we cover yours? I think we got Jerry, so I'm going to move on to Rose. If someone can help me unmute, perfect. Oh, Rose, you might be on mute.
Oh,
There
can
we
you hear
go.
me now?
Yes.
My question is about traveling and benefits. So if you travel out of state and have like a health emergency, would it be covered, and how would you go about getting it covered?
Yeah. So we do cover emergency care worldwide, actually. And then you also have urgent care within the US and its territories. So you can still present your card, at least if you're within the United States, you can still present your Samaritan Advantage insurance card, and they should be able to bill us, and you would pay the same cost as if you were in network for those services. For the emergency, if you're in another country, typically you end up paying out of pocket for that, and then you need to submit for reimbursement to us for that.
Okay, thank you.
Yeah. Jim and Sue.
Okay, can you hear me?
I can hear you, yes.
Okay, for the dual purpose items on the over-the-counter, the catalog says that you have to, or that you have, yeah, that you have to have the physician's permission or recommendation for it. So what paperwork is involved in that? I asked my doctor and he says, wow, I don't know anything about it.
Yeah, that's actually not something that we enforce as far as needing an actual copy of a recommendation from your provider or visit notes. So we operate kind of on good faith for that one, and trust that, you know, if that's something you've had a conversation with your doctor with, and even if you haven't, it's not a rule that we enforce.
Okay, so I've done it anyway, I guess, so I will just
Yeah.
it. Thank you.
Yeah, you're welcome. Looks like Younga is next.
Yes, can you hear me?
Yes, I can hear you.
Can we still use the reimbursement forms? I buy AirReds too, and I have coupons for them, and I can get them cheaper buying them in the store and using my own personal MasterCard or Visa card to pay for them. So are you accepting these reimbursement forms still?
Yes, we will still accept reimbursement forms for over-the-counter items that you purchase out of pocket.
Thank you.
You're welcome. Good question. Thank you. Shelby.
I was just concerned, or I was a little confused by your over-the-counter catalog, because it just mentions things like toothpaste or things like that. But can we choose our own brands on things like that?
Not if you're purchasing through the catalog. So it is a specific set of items that are available through that.
For all of the things that are in the catalog, you just, okay, because I mean,
Yeah.
I bought a few things at Safeway yesterday, and I just, in case anybody wants to know, I put my card in and it took them all, even though they were the same brands that were in your catalog. So Safeway at least honored the card.
That's great to hear. Thank you for that. Yeah, it's definitely, you know, we know that that's been a pain point for a lot of members. So, you know, we added that catalog feature to help with that. So you could get some of those items without, you know, having to guess if your card was going to work or not. So
yeah. They weren't sure when I asked, and she said, try it, see what happens. And it took them all. So, and none of them, I mean, they were my brands, and I didn't have to go through your catalog and say, well, gee, what brand am I going to get? So.
Yeah. Yeah. And that brings up another good point too, that we've heard a couple members ask for or mention, is that for the catalog, the items that are online, it doesn't necessarily show you, I guess, the brand or the ingredients or the back of the packaging. So we have talked to our vendor about that, and that is something that they're going to add for 2023. So it's going to take them a little while to get all those images taken and get everything uploaded, but that is something that they're working towards doing for future.
Okay, thank you.
Maria?
Yes, for the over-the-counter benefit card, can you still use that card for online purchases and in retail stores?
Yes, absolutely.
Okay, and is it
That,
only, oh, I'm sorry,
oh no, go ahead.
is it only for the items that are now listed in the catalog, or can it be for other things also?
It can be for other things also. So the catalog was really just kind of an enhancement to it. So
Okay.
it gives you another option to make purchases, but it is limited. So really our goal is to try and give you, so many choices for where you want to be able to buy things and what you can buy, which, I realize has some heartache with it. There's some things that don't work, unfortunately, the way that we would want it to, but we really, our goal is just to give you access to that.
Sounds perfect, and we really do appreciate having this opportunity to
Thank
get things
you.
like that. Thank you.
Thanks so much. Karen.
Hello.
Oh, hi, Karen. We can hear you.
Okay. I was wondering if the Silver and Fit program works for someone on the special needs program.
Yes. So that benefit is offered on our special needs plan, and it does not cost you anything out of pocket to use that benefit.
Is there somewhere in Lincoln City? Do you know?
Yeah, I believe there's several facilities within Lincoln City. So you can either go online to that website or contact customer service and they can help you, or through Silver and Fit's customer service. I think they'll transfer you. There is a direct Silver and Fit customer service number, but they can help you with that.
Okay. I have one more question, please.
Sure.
I recently had my teeth pulled and I've got spicula, I don't know if you know what that is, stuck in my gum, and I was surprised because I went to the dentist and they said that my card would cover that to get that taken out. And I thought all I had was over-the-counter hearing and the vision.
Yeah.
But she ran the card and she said, no, it'll cover it. So I was confused because I called and it doesn't say anything about dental, on there at all.
Yeah, we might have to look at that a little bit closer, Karen, because if you are on the special needs plan, we don't offer dental benefits through your Medicare coverage, but you do have dental, or you should have dental through your Medicaid coverage.
Oh.
Potentially. So.
Oh, well, maybe, I don't know. I gave her the blue card and she said it would cover it, so I made an appointment.
Yeah, it wouldn't be covered if you're on the special needs plan. It wouldn't be covered using your benefits MasterCard.
Oh, well, maybe she was talking about the Medicaid.
So yeah, so maybe through that.
I don't know how that works. So.
Yeah, so you might follow up with our customer service team. They can look a little bit closer at your account and maybe help you navigate that.
All right, hon. Thank you.
Thank you. Donna, you are next.
This is another dental coverage question.
Okay.
I was expecting to have a copay when I had my 6-month cleaning, and they said no, that I had to pay it out of my benefits card. But that seems the opposite of what you did in the presentation.
No, so for your dental benefit, you have a flat amount that's covered per year for preventive and comprehensive dental. So that's your things like cleanings, x-rays, restorative services, periodontic, basically anything that's not like a surgery of your jaw. That's covered under the preventive and comprehensive dental benefit, which is the money that's loaded onto your benefits MasterCard. So depending on what plan you have either $750, $1,000, or $2,000 to spend for the whole year. So you wouldn't pay a copay. You just have that amount to spend on services, if that makes sense.
Well, it is what they would have done because I ended up having to pay $200 for a cleaning. So that was right. And I didn't have to pay the copay.
Correct.
Am I following? Okay.
Yep.
Then I don't understand what the information you presented about the copay change, what that affects as far as dental coverage.
Sure. So that benefit change was for the Medicare covered dental benefit specifically, which is a very specific subset of services. Not a lot of members will probably need to use that benefit unless, like I said, it's limited to surgery of your jaw, or if you need teeth pulled prior to a radiation therapy, or because of neoplastic disease. So it's a very small set of services that are covered under that one.
Okay, thanks for that clarification.
Yeah, you're welcome. Thank you for the question. Linda is next.
In the notes that I'm having trouble getting my PCP to understand that I don't have a copay. How often do the providers get told when the copay's changed? Because they've been charging me $15 and I'm on Premier Plan Plus. And in fact, I was just there this morning and they charged me $15 and I said, but I don't have a copay for PCP. And the same thing at urgent care and in emergency is always higher than what I've been told. So I must have a credit with you guys somewhere along the line.
Yeah, so we do a lot of provider outreach through our provider relations team, and we host a webinar. So we have a lot of avenues where we try to make providers aware of those changes as much as we can. Obviously with, change in staff and the difference between, the provider and their front office staff and billing, that doesn't always get through, but typically, they can call us and ask us for confirmation of what your copay amount is. That's something that providers do quite frequently. So I'm a little surprised to hear that if you told them it was different, they didn't try that.
It's not the first time. It's not the first time. So I'll just take my book with me next time.
Yeah, and we also, when we process a claim, they get, you get an explanation of benefits in the mail. They get something similar. It's called a provider remittance, and it would show that difference on there.
Yeah, and I get them with zero that I have to pay, but I make a note that I'd already paid them, and I have the receipt that shows I paid them. So
you should be able to contact whoever the billing office is for them. And normally they would refund you the difference of that amount.
Okay.
So
I will take that in charge next. Thank you.
It looks like Shelby has her hand up.
Hi. Did you just say that we're supposed to have actually 2 credit cards now, one for benefits and one for FlexPay?
No, you still just have the one benefits MasterCard.
Okay, because I was confused because I thought I don't have 2.
Yeah, no, still just the one.
Okay, thank you.
Thanks. Jim and Sue have their hand up again. Oh, I heard you for a second. You might be muted.
Okay, there it went.
There we go.
Yeah. Okay, so we've been on the Premium Plus for a number of years. And this year I spent the time and went through line by line the difference between Premium Plus and Premium. And one is $129 a year and one is $19 or $28 a year and $19. And I can't find any reason to stay on Plus. So can you give me some reasons that are more than a difference of $5 in copay and things like that would say that the $128 a month is worth it, the big stuff?
Sure. So one of the biggest differences is you do get $1,000 more a year for dental coverage. You also have higher hearing aid coverage. and the Part D benefits are also better. So you have no deductible on that plan. And then you also get extra coverage during the donut hole or the coverage gap phase for drugs that are in certain tiers. So it helps keep your costs lower there. Along with some of the things you already mentioned that are a little bit smaller copay differences, like your PCP and that kind of thing.
Yeah. So it really depends on whether you're going to use dental big time or things like this.
Yeah, and our sales team is really probably better to answer that, and I have to be a little bit careful about what I say because I can't get into the sales side of things in my role. So, you know, if you have questions related to that, then I would encourage you to call and talk to sales about that.
Okay, thank you.
Yeah. Brian, is his hand up? 1 minute left.
Hello. So I was going to ask a question. Is there a list of retailers in the area that we could reference that will accept the OTC card?
So there is a online, there's a directory of the local stores that are covered, but I don't have a full list printed out. We list kind of the most common ones that are in our area, which are Walmart, Fred Meyer, Bi-Mart, Walgreens, Safeway, that someone mentioned. Those are the biggest ones that are kind of available in all of our service area. But if you do want a more full list, we can look into that for you, and we'll provide it in the follow-up from this meeting.
So another question is can you order from Amazon things that you
Yes,
could use?
you can. Yeah, we have seen successful transactions through Amazon.
Okay. Sounds good. So what happens when you go to the counter and you try to ring up your stuff and it doesn't go through? Do we contact somebody with Samaritan, or how do we navigate that?
Sure. So the options, if it's not working at the register, you can either, you know, ask them to put those items back for you, or you can pay out of pocket and submit a reimbursement form for those items. Yeah, but unfortunately there isn't anything, you know, that we can do to force a transaction to work.
I see. Okay. That's all I have. Thank you very much.
All right. Thank you. We are at the end of our time for today. I know we had a lot of questions in the chat that I maybe didn't get to, so we'll be sure to follow up with those. And when we send you your $15 gift card for joining us today. So this will be the last meeting that we do for the year. So thank you all so much for joining us. I hope you have a wonderful rest of your year and holiday season, and hope that you all are members next year. And we'll see you for the next virtual event.